Hello, my name is Agustina Sepulveda. I will be discussing illicit drug use in youth, specifically fentanyl use in juveniles. And this is for Juvenile Crime and Violence, a course at Alliant University. And the purpose of this podcast slash presentation is to bring awareness to fentanyl use in juveniles as well as discuss policy implications in harm reduction. So briefly looking at the bigger picture of the fentanyl crisis in youth, the United States is currently witnessing a severe fentanyl crisis, specifically in the juvenile population. A study by Friedman, Godwin, and Shover in 2021 reported that over 77% of adolescent drug overdose deaths in the year of 2021 were related to only fentanyl. Some of the other statistics under the 77% had to do with meth and other drugs. However, over 77% were only fentanyl use. And specifically fentanyl, it's typically added to other illegal drugs unknowingly. And it is 50 to 100 times more potent than heroin, oxycodone, or morphine. So because of the ingesting of fentanyl being mainly unknowingly to other drugs, that is what makes the crisis even worse. Um, Specifically, some facts about street fentanyl. Fentanyl is often added to other drugs unknowingly. It can be used in various forms, including in pills, in pure powder, in powdered mix with other drugs, or in patches. It is a type of opioid narcotic. It's typically a prescription that's drug use for cancer patients that are severely in pain. But now we're seeing an increased crisis in juveniles. And some sociological factors that might be contributing to fentanyl use and distribution of fentanyl. One of the first ones being fitting in or wanting to celebrate. So in the areas of fitting in, just wanting to partake, celebrate with friends, that tends to be a significant contributor to fentanyl use because many times a lot of juveniles are celebrating and they're unknowingly ingesting fentanyl or other drugs that are laced with fentanyl. In addition to that, peer pressure can also fall under this category, giving that, wanting to fit in with friends, that might be a significant contributor to this. Peer pressure to use drugs and then unknowingly ingesting fentanyl without knowing that it's laced. Another sociological factor would be poor attachment. So as discussed in the past and in social in this course, the social bonds to other attachments, meaning if juveniles lack attachment from parents or positive role models, they're more likely to engage in drug use. And that's only because they're seeking attachment to something else, whether that's a group of persons or whether that's a parent. When juveniles lack poor attachment, they're more likely to engage in drug use. Another sociological factor contributing to fentanyl use and distribution would be socioeconomic status. So juveniles that come from families with a lower socioeconomic background, they're more likely to be affected through drug use because of lack of basic needs or lack of basic necessities, or maybe lack of understanding how to maneuver various resources. And so many times, for example, if juveniles come from families that are single parent households, perhaps their income is a lot lower, they're attending schools that are in, worser neighborhoods, all of that can be contributing to the distribution and use of fentanyl. One of the biggest factors contributing, though, would be social media. And social media is a significant contributor because that is how a lot of juveniles are communicating right now. They're using social media platforms to buy and to sell various drugs. And in the federal system, when you are distributing drugs, specifically fentanyl, there has been an increase in using Snapchat as far as selling and distributing and buying and reaching out to persons um, that have the fentanyl or that have drugs that are laced with fentanyl. So social media platforms, again, that's a huge contributor. That's the main way that juveniles are communicating right now, but that also places them at risk of um, using drugs and overall just being exposed to fentanyl. So just as a recap, some sociological factors would be fitting in, celebrations, poor attachment, socioeconomic status, social media, and peer pressure. And potential implications for policies and prevention strategies. So, focusing a lot on harm reduction, right? So, having access to naloxone/Narcan at schools or maybe school contracted facilities. And that's primarily because of the high numbers of juveniles, specifically juveniles that have access to fentanyl. And so, having access to Narcan either through contracted facilities or through schools. That is a potential prevention strategy and a policy implication. Secondly, safe drug consumption sites. There's been a lot of skepticism around this, but potential implications can be to provide sites where drug consumption would be safer, and that would be to monitor withdrawal symptoms or overall the drug use by medical and clinical staff. And then lastly, focus on the psychoeducation in schools. So preventative programs tailored specifically for juveniles and their parents, and educating students and their parents on fentanyl and how easily it can be to hide the drug, given that it is extremely potent. It is primarily ingested unknowingly by juveniles. And so providing that education that will significantly provide prevention overall. So